GLP-1 agonists are great medications for diabetes and/or weight loss. We'd like to offer a few helpful hints before taking your first dose in order to be more comfortable and minimize side effects.
GLP-1 agonist medications are prescribed for type 2 diabetes and obesity, which are very related conditions. They have also been shown to be helpful in some forms of heart failure. Examples of these medications are Trulicity, Ozempic, Wegovy, and the newest one, Mounjaro. There have been supply difficulties with these medications, but the availability is improving, and they are more and more widely used each day. They work in multiple areas of the body to decrease appetite and binge eating, regulate blood sugar, and burn body fat. This video is not meant to cover these medications in depth, but rather to give you a few general tips before taking your first dose. Nearly all of them are injectable medications. Speak with your prescribing doctor or healthcare provider about your personal situation and whether these tips are right for you.
Here's our first tip. Avoid eating a big heavy meal during the few hours before your first dose of a GLP-1 agonist like Ozempic or Mounjaro. You don't want an empty stomach, but you don't want an overfull stomach either. One of the ways these medications work is to slow down how quickly food moves from your stomach into the rest of your digestive tract. If you fill up with a big heavy meal just before your dose, you'll feel that meal sitting there for a long time.
Common side effects of medicines like Ozempic or Mounjaro occur most with the very first dose, or whenever the dosage is increased. People often experience mild nausea. Have over-the-counter anti-nausea medication on hand, or ask your doctor or healthcare provider for a prescription anti-nausea medication just in case you need it. Have some over-the-counter antacids in case of heartburn, and some Advil or Tylenol in case of headache. GLP-1 agonists strongly affect your whole digestive system. Both diarrhea and constipation are possible side effects. Be sure you have over-the-counter remedies on hand for those issues as well. Talk with your doctor about whether the over-the-counter medicines we just talked about are appropriate for you. Seek immediate medical care for any severe side effects, especially stomach pain. Remember, side effects are usually tolerable and fade with time.
This is our final tip. Before taking an injectable GLP-1 medication, such as Ozempic, Wegovy, or Mounjaro, take it out of the fridge and let it come to room temperature. Check the package to be sure, but most of these medications can be safely outside of the refrigerator for hours or days. By letting it come naturally to room temperature, you will decrease any sting you'll feel while giving yourself the dose.
Thanks for watching. Add any tips you have for taking the first dose of a GLP-1 agonist in the comments, and please hit like and subscribe below. See you next time.